Let's talk about asthma. There are several factors that trigger an asthma attack, which include inflammatory factors such as allergens and respiratory infections, irritants such as exercise and temperature changes, and others such as medications, food additives, and pollutants. All of these cause the bronchial tube to tighten and thicken, resulting in inflamed and mucus-filled air passages. These are some of the various types of medications: relievers, which are short-acting beta agonists, controllers, which are long-acting beta agonists, preventers, which are inhaled corticosteroids, and combinations, which include two types of asthma drug therapies for better relief. We found all of our references from a really reliable source. Once upon a time, there was a single working mother named Mrs. S. She is a 30-year-old African American woman with two preschool-aged children. Hours ago, Mrs. S was admitted in the emergency department for an acute asthma attack due to her shortness of breath and tightness in chest. She used an albuterol MDI without a pacer repeatedly at home with no relief. Treatment in the emergency department was with a nebulized albuterol. Mrs. S responded quickly and was discharged. Mrs. S was glad to be home to play with her children. Few minutes later, Mrs. S started to feel tired, so she decided to just watch her kids play. All of a sudden, Mrs. S started feeling wheezing, dyspnea, anxiety, more wheezing, more dyspnea, more anxiety. The kids finally realized that their mom was in trouble. They tried to call for help, but didn't exactly know how. Unfortunately, Mrs. S returned to the emergency department. Shortly after, the nurse immediately placed a nasal cannula on Mrs. S due to her labored breathing. She then takes her vitals. The nurse starts off with Mrs. S's oxygen saturation, her heart rate, her temperature, her pulse, her respiratory rate, her blood pressure, Mrs. S concluded with her pain rate. In Mrs. S's chart, the nurse finds that she is allergic to smoke and has a history of pneumonia and a history of hypertension. These are her arterial blood gas values, and this is her perfusion expiratory flow rate. Her lab values indicate that she is experiencing respiratory distress. We suggest that she retake her labs before she is discharged to ensure that she returns within normal limits. The nurse performed a focus assessment on Mrs. S's lungs. The nurse had difficulty understanding her patient as she can only speak 1 to 3 words at a time. The nurse gives her paper and pen to communicate. The nurse understands the head of the bed at a 30-degree angle will help alleviate her breathing. Afterwards, the nurse provides her patient an incentive spirometer to practice exhaling. This will help her get back to baseline. Next, the nurse teaches her patient how to perform deep breathing exercises. Take a deep breath in and breathe it all out. The nurse then provides her patient with a therapeutic massage, followed by lowering the lights to help decrease her anxiety. After giving the patient some rest, the nurse offers a brochure and another, and how about one more as a means to refer her to support groups, non-pharmacological techniques, and other ways to educate her family about asthma. The social worker then arrives to speak with the patient about her finances, living arrangement, family support, and childcare. The nurse suggests to her doctor if she can be prescribed the nebulized albuterol, which she responded well to in the emergency department earlier today. Mrs. S's vitals and labs came back normal and her physical symptoms went away. She was finally discharged. She returned home and lived happily ever after.